name's Rick Davis, and I live halfway between the Dalles and Hood River. And I thought I was through writing letters about repeal and replace of the Affordable Care Act. But rumors out of Washington are that Republican leaders in the White House are meeting with the Freedom Caucus to negotiate changes to the bill that would allow the Freedom Caucus to support it and push through that legislation. The three conditions that the Freedom Caucus is saying they need to get their votes are: one, to repeal all the essential health benefits; two, to do away with community rating. Community rating, doing away with that would allow insurers to charge women more for health insurance. It would allow insurers to charge more for people with pre-existing conditions. The third condition would be to repeal the requirement for guaranteed issuance or access. Essentially, an insurance company would no longer be required to offer you insurance. Those three things, I think, take us back to pre-ACA dates. So my question, Mr. Walden, is: one, are you involved in those negotiations with the White House and the Freedom Caucus? Two, would you support rollback of community rating and rollback of guaranteed issuance? And if you would support a bill with those provisions, how do you square it with your own legislation that you submitted, the pre-existing Protection Act, which wouldn't allow any of the things that you're currently negotiating about? So please let me know, and please let me start writing about tax policy instead of health care.
Hi, Mr. Walden. My name is Laura Dunn, and I'm from Hood River. I'm a 20-year resident of Hood River. I'm a speech pathologist in the schools in the Dalles. And I'm supposed to tell a little personal story, if we could. And all I can say is that I felt depressed and despondent every day since November 11th. And I'm probably not the only one here. There's a lot of things that I feel really alarmed and dismayed about with this administration, but probably most by Donald Trump's authoritarian tendencies, his dangerous lies about rampant voter fraud, and they undermine distrust, they undermine trust in our election system, and I believe they set the stage for clampdowns on voter access, which we already see occurring across the country. His repeated attacks on the mainstream media outlets are equally alarming. He refers to our constitutionally guaranteed free press as the enemy of the American people. And he promotes propaganda and misinformation by referring to any unfavorable news, any unfavorable coverage of his administration as fake news. Free and fair elections and a free press are cornerstones of our democracy. These false claims are more than just irresponsible and unseemly in our president. They pose a real threat to our democracy and our freedom. When will you speak out against Trump's outrageous claims?
Congressman, I welcome the opportunity to talk to you again. I spoke a little bit to you out at the town hall at Arlington. My name is Stu Watson. You know me. We've worked together on some other issues like the Mount Hood land exchange. But I want to get back to the ACA issue. I have a little story. For many years, as an independent communications consultant, I bought my own insurance, paid increasingly huge premiums, Every year they went up. Every year I ratcheted up my deductible to try and stay within the affordability range. Never used a dime of health insurance for a good 10 years, 12 years. Along comes the ACA, takes effect in 2014. And for the first time, as a result of that, I was able to get healthcare coverage for a diagnostic procedure called a colonoscopy. So I finally did what I should have done 14 years earlier. They say you're supposed to get one at age 50. So I had the diagnostic test, and I had a surprise. No, it was not Jimmy Hoffa hiding out. But there was a large object, and my mind went rampant with concern about what it might be. Thank God, it was not malignant, and they were able to remove it with a follow-up surgery that cost my insurance company $40,000, cost me out of pocket for deductible payment $11,000. And so the question I have to you is, why would you do away with a healthcare act that allowed that to happen? And why are the healthcare costs in this country bankrupting this country?
I spoke to you at one of your previous meetings. My name is Rusty Whitney. I spoke to you about the ACA. Tonight I'm passing along some questions from South Wasco County citizens. We'd like to see more bipartisanship in both parties in terms of writing and passing legislation, and less blaming and pointing fingers and posturing. You have said many times that the ACA is imploding and is in a death spiral. But nonpartisan agencies that have been evaluating the ACA, including the CBO and the RAND Corporation, say that's not true. They say market forces will stabilize the insurance offerings in these areas that are currently struggling with over the next 2 years. What nonpartisan data are you relying on that contradicts that? And finally, the news is reporting that the next replacement proposal for the ACA will do away with several essential health benefits that current plans are required to cover, including maternity, newborn care, mental health care, and pre-existing conditions. Which of these do you support eliminating? Thank you.
Okay, our next group, 656, 670, 669, and 694.
I can never tell this story without crying, and I'm really sorry. I'm Sandra Hagel from the Dalles, Oregon. I wanted to know from Mr. Walden. I called so many times when they were working on their AHA. What are you thinking of taking Medicaid away from seniors? My mother is in assisted living. She has sold her home. She has sold her car. She has nothing left except a small amount of money. When that's gone for her assisted living, she needs to go on Medicaid. She's going to have to do that before you take it away. What are these people going to do? I volunteer with 3 different senior agencies. They are in the same boat. My mother is living with people who are in the same boat. What are they going to do? We need single payer or Medicare for all. This is not a tenable situation. The rest of the developed world knows better. My cousins from foreign countries are afraid to come here because if they get sick, what are they going to do? They cannot get care like we can get care when we go visit them. Thank you, Mr. Walden. I hope to see you next week, and I hope to get some answers. Your answering machine always says, I'll get right back to you. He has never gotten back to me yet.
I'm Mark Reynolds. I live near Odell, Oregon. And I want to ask Congressman Walden some questions about immigration enforcement. I was a teacher in both the Dalles and in Hood River for many years, working with students who were here to follow with their families the crops that we all depend on, that put food on our table every day. And I found among those students some of the hardest working, most sincere and law-abiding teenagers I'd ever met, and their families. Were honorable, supported their children every way they could, and wanted to work hard to make a success here in the U.S. So my question for you, Congressman Walden, is when will you act and call for a moratorium on ICE incursions into our communities? Immigration and enforcement does not make us safer. Rather, it sows confusion and fear. We have state, county, and city law enforcement to keep us safe. We don't fear our friends and neighbors. Act to keep ICE out of our communities. Act to keep our immigrant friends and neighbors safe. Thank you.
Very nervous to be here speaking with you. My name is Elizabeth Foster. I go by Beth. I've only lived in the Gorge for just about 10 years, and I think many people have said more eloquently what I scrawled on the back of this piece of paper once I came. But first I want to say to Greg Walden, thank you for your service. I trust that you're learning more about healthcare in your current roles. And as a physician and an economist, and chairperson of the Clinical Advisory Committee for Obamacare for Medicaid in our 2 counties. Here in the Gorge, I've seen firsthand how greater access to health care has improved health and decreased stress in our community. I think you would be very pleased to note the levels of cooperation towards improving the quality and access to care that we've achieved in Hood River and Wasco County. I would like to see the same level of collaboration and work towards quality of healthcare in Washington, D.C. I would like to see you work with us towards covering all Americans. Continuing to require insurance companies to cover the 10 essential health benefits that have been defined, and to think about that even more broadly. And also, I think it's really important that we require health insurance companies to work in rural and urban areas alike if they're going to have the privilege of providing insurance. And I think I would like to encourage you to consider working very hard to provide all of us with the level of coverage provided to you and your family.